Then I moved on to gel injections. And they all kind of worked. And I was continuing to be able to lead my life. I like to play golf, so that was important to me. And eventually the doctor was saying, you're going to know when you want to have surgery. So
Based on the pain?
I guess based on the overall, the way I was feeling about my knee and what I could do. I had a period where I was on crutches, but the gel shots seemed to really help that. In my neighborhood, I live in a senior community. Being a senior, there's a lot of people that have knee surgeries. So I'd see all these guys. Some of them were limping around, and some of them were doing well. I think it depended a lot. It seems the guys that were overweight had a longer recovery period. I'm really not overweight, but I wasn't sure I wanted to go through that. But I kept waking up at night with pain, and I didn't really like that.
So the pain would wake up in the middle of the night. It wasn't just you being able to function during the day or go golf, but at night it was interrupting your sleep now.
Yes, and I was icing quite a bit. So I heard about the stem cells. I think we saw an ad in the newspaper. We answered the ad, and we went to a seminar. The reason I did is I didn't really want to go through the rehab of surgery. Because I read some articles. A lot of those people said their knees didn't feel better after the surgery. So we went to the seminar, and we decided to do the injections. I didn't tell my doctor at the core center where I was going, because I had mentioned it to him once, and he said, well, it's not a proven thing. And so he said, if you want to do that, it's your decision, but he said I wouldn't do it personally because he said the results are not proven.
Did you know anybody else? And this is part of the debate.
Yeah.
Well, this is kind of a big experiment. It's not proven, but then we're talking to people who are getting this type of cell therapy, and they're saying the results are great. I don't know if, again, percentage wise, what's the percentage of people getting results? I'm not sure. But did you know anybody that got it?
I didn't actually know anybody.
Wow.
And I think before I had the stem cells, I told a few of my friends I was going to have it, and they were curious about the cost, because the cost, I think, maybe stops a lot of people from trying it. And hopefully, by doing this interview and helping the cause, we'll get this to be approved by the government in terms of Medicare.
Well, by virtue of you saying that, you must be pretty pleased with the results you got.
I'm extremely pleased.
So tell me, how long ago did you actually have this treatment done?
I had my first shots in early July.
So we're talking about 8 months or so ago?
Yeah, eight months. And it's strange. I think I went through some periods where I was feeling, is this really working, But it seems the longer that I get away from when I actually had the shots, the better my knee feels.
So are the providers, the people who did this, they're saying, hey, it repairs over time, and with more time it should be getting better? Is that the expectation?
I think that's what they told me, but in my case it appears to be true.
Yeah.
Now, I am noticing pain, unfortunately, in my other knee, my left knee, because I think it's just a sign of bone on bone and arthritis.
The pain that you had before, like you were talking about, not being able to golf, waking up at night. Are you waking up at night in pain anymore, or that's gone?
No, no pain.
No pain at all.
I don't know if it's strange, but every once in a while, I might be walking on the golf course and I'll just feel a little stab of pain. But I think that's just, it might be my left knee.
Yeah.
I don't know. I've thought about this a lot. How perfect this procedure is, and to me, if I could get by and be happy with it, I would say it was 100% successful. Wow. And that's where I am right now, and I'm just praying that it will continue that way into the future, because I would like to not have to pay for more shots.
How long did it take before you started to experience a change?
I would say initially a couple days. It was amazing.
That fast?
Yeah, it was really fast.
And were you on any medications at the time trying to manage your knee pain?
The only one that I had tried a lot over-the-counter stuff. So I found this one. It's called Arthur D. I don't know if you've heard of that. But this Arthur D, you take 2 pills a day, and there's all glucosamine you could take, all kinds of things. But this Arthur D gave me the most relief, and I still take it. I guess I'm afraid not to take it.
Yeah, but it might be interesting to find out what happens when you stop.
I don't want to stop because my knee feels good.
But you were still taking this and having pain before, even when you were taking it?
Oh, definitely.
Yeah.
I was taking it, but I couldn't sleep through the night. But what it did, it allowed me to play golf and do the things I like. Without a lot of pain.
Yeah. So very interesting. So basically, you feel like this knee is, for the most part, a normal knee, your right knee at this point.
I think for my age, it is normal as it's going to get.
Yeah, interesting.
I mean, you have all kinds of creaks and groans when you get older. It's coming to you too.
Well, have you noticed anything else outside the knee that maybe got better?
You know, it's hard to tell. I think overall, I felt like I had more energy, and I know I had injections both in my knee, and then I had an intravenous. So the intravenous, the little cells went all over. I think I felt better. You know.
Yeah, that's great.
Yeah.
Well, I wish you continued healing and more time on the golf course. And
Right.
I certainly appreciate you coming and sharing your time with us.
Oh, I'm happy to do it. I just hope that, through the efforts that more people in our country can take advantage of this.
Yeah. Well, thank you.
Oh, you're welcome.